The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, and welcome to today's webinar. My name is Manager, and we'll be discussing the Fortinet Security Fabric and how it can enable a safer healthcare environment. Hopefully, all of you can hear me clearly. We'll just give maybe a couple more, maybe a minute or so for other people to join into the webinar, and then we'll start. Okay, let's get started. Thanks for joining us again this morning. I'll run through the Fortinet Fabric and how that architecture works in helping to secure a safer healthcare practice. If you have any questions, please just don't hesitate to ask those questions. I'll get back to you at the end of the presentation. Just a quick intro to myself and Wavelink before we get started. To those of you who are not aware of either myself or Wavelink, I joined Wavelink about 6 months ago, and before that I was on the customer side for over 10 years. Coming from the customer side, I was lucky to gain a decent exposure working across technology, governance, and people. And if you and your team would like, more than happy to share my knowledge and experience in that side. I have my contact info shared at the end of the presentation, so yes, please feel free to get in touch. In relation to Wavelink, the company was founded in 1998. We have offices in Melbourne, Sydney, and Brisbane, and as you can see, we have a few verticals that we work quite a bit in. Healthcare obviously being one of them. So from a discussion point of view for today's webinar, I thought it would be good to start off with some stats regarding the state of the healthcare industry first. As a customer, it was always important for me to know numbers. It not only gave me a good overview, I guess, of the situation, but it also helped when discussing with decision makers on why and when to invest in cyber technology. From my experience, the more independent the numbers are, the better it is. One thing to keep in mind, though, with the stats I'm going to show you, that most of these stats are actually from the US, where the breach notification laws are more stringent compared to that of Australia. We should hopefully get better insight in Australia starting next year when the new privacy laws come into effect. I think that's going to be sometime in February 2008, fingers crossed. Following the stats, we'll look at the attack vectors that are most concerned to the healthcare sector and why I believe these attack vectors are successful. We will then move on to discuss how the fabric solution that Fortinet have put together enables the healthcare organizations to gain a much better security posture than it has today. I will spend a little bit of time going through the main components of the fabric and then highlight some key values, each of the puzzles within that fabric brings to the customer by using my experience as one before. I cannot stress how important it is that when you place a solution or product, to always think as a customer. I mean, each customer, as we know, are unique in how they do their business and their strategy. And the more aligned we are with the customer, the more successful we can be in placing solutions. To end the webinar, I will quickly touch on some case studies and help customers that Fortinet have under their belt. I will also talk to you about the Wavelink's value proposition to the partner channel and how we can all work together to enable the customer's security posture. Following all of this, I will spend some time to go through any questions you may have, and so yeah, let's get started as we have plenty to get through. So looking at the statistics studies in front of you, I found it to be quite interesting. I think the first thing that stood out for me was that when looking at the bigger picture of the healthcare industry, it faced more than a quarter of the successful breaches as compared to other industries. I mean, 27% is a big number compared with, for example, education or financial rates like 12 or 11%. Some of you might think, of course, that's because they get more attacks, but that's not usually the case. Usually, it's the government and the financial sectors that actually get most attacks. If you do a little bit of digging in deeper, what I was able to find that the 263 number, which is the incident that is listed on this slide, was actually from the first quarter of 2016. It's pretty decent number of attacks, I guess. But when you look at it even more in depth, that was actually around 70% of the attacks that happened across the whole year in 2015. So that's a massively big jump from the last year, from the previous year actually. At the end of the year, of course, this number actually increased to 450. Now, you know what, 450 might not look as a lot of attacks, but if you take it across the entire year, that's actually one successful attack a day against a hospital, a clinic, a biomedical facility, or anything else in the same nature. And that's pretty big, I would think, at this, when it comes to healthcare environments. If you take the 450 a little further, right, and if we think it was unique to each hospital and then apply it to Australia, where at the moment there's about 1,400 hospitals, that would cover almost 1/3 of the total hospitals in the country that will have faced a successful attack within 1 year cycle. That's massive. 1/3 is quite a big number when you look at in Australian terms, for example. As we know, with the latest WannaCry attack, which was in some of the hospitals in UK and so on, and some of the hospitals in Australia, I think the number is only just going to go up and up in 2017. So, we'll have to wait for the statistics for that next year, and hopefully once they come out, I'll be able to share it across with all of you. With this one, I mean, it's good to see the graph in regards to the impacted healthcare breaches. I mean, from an individual point of view, there's been a major shift over the past couple of years. In 2015, you can see there is just under 120 million records that were breached. In 2016, it's just around the 171 million mark. Why has there been a sharp increase? Well, one of the main reasons why there's been a sharp increase is because these records are highly valuable. I mean, they're more valuable than your financial records. That's extremely why why there's more and more targets against these industries. The 2015 attack was actually against Anthem, which was actually a major one. They lost about 80 million records. So it wasn't a lot compared to the entire figures. When you compare it, all the other ones in 2016, they were the highest number was actually 3.5 million or 3.6 million. So they didn't lose as big number, but there were actually more attacks, successful attacks in 2016 compared to 2015. For me, this says a couple of things. It says that the bad guys are always finding ways to change their tactics and to stay ahead of the curve. And secondly, they're also trying to attack many small organizations compared to attacking one large organization which might have more funding, or at least putting more funding for cybersecurity after the Anthem attack in 2015. Before we move on to uh, most, before I want to move on, actually, I want to talk about another stat that was actually helpful in 2016, and that was the IDC's Health Insights Group prediction, where they actually said 1 in 3 healthcare recipients will be the victim of a healthcare breach. Looking at this table, of course, we can see that the numbers well past. So why is healthcare targeted? As I said before, you know what, it's mainly targeted because of the value in terms of the dollar, right? As you can see in this particular table, you can see that the healthcare industry is valued around $402 for each record that it loses. And I guess that's understandable, right? I mean, as criminals, they can get much more information about a person, from their personal details to medical information to even highly sensitive corporate information relating to new and emerging products if they are successful to breach a healthcare organization. We need to keep in mind that just like organizations, patients and staff can be affected as well with a breach. Right? Some of the methods that harm them are by increasing the risk of their personal health facts being disclosed. In other times, it increases the risk of medical and financial identity theft being disclosed, and in some cases, even risk of blackmail to ensure the information is not disclosed. So as you can see, it's definitely not a good situation to be in. As we all know, healthcare's core mission has always been to provide the best care possible. The industry is in the process of transforming how they deliver care, and to do this, they adopt IT-driven technologies and trends like connected medical devices, Internet of Things, applications, cloud, and so on. However, as you can see, most of these platforms are not secure off the bat, as the main objective is to connect first and do that as quickly as possible with less people and resources, just like other industries, I guess. Looking at some of the numbers listed, I guess it's safe to say that most instances security is not even in the discussion table. So what does this mean for the healthcare industry in the bigger picture? It means that the industry pays over $6 billion in data breach costs on a yearly basis. I mean, that's a large number. You look at, and you know, these stats are usually from the US at the moment. You know, when Australian stats come out in the next year, couple of years, you know, that number is only going to go up. So, you know, there's definitely, you know, it's a sad situation to be in, but, you know, hopefully we can, you know, being security professionals, we can hopefully find some good solutions. And I think Fortinet has a good, you know, good solution product sets that can be applied to these environments. So I guess that's enough numbers for the moment. Let's look at the attack vectors that are used a lot in the healthcare environment. So from a health external point of view, the main threats that I see as the top attack vectors that are of most concern are denial of service attacks delivered by botnets, um, phishing, spear phishing attacks, which deliver malware and ransomware. Between the four listed, the bad actors are able to, you should be able to get a serious damage on the ongoing daily operations of the medical institution. Now, this is a little bit different to top internal threats, which from my point of view are mobile devices and the BYOD policies that are applied on them. Another internal threat is limited budget, insider misuse, unintentional actions. And finally, you always have the supply chain. The supply chain is a key point for me. It's extremely hard to lock down due to the nature of how these organizations work. They have many organizations, third parties, that work together, to get information to supply information to the healthcare, to the doctors, and so on. And it's extremely hard to lock down these organizations. So why are these attacks more successful? Well, from my experience, it's usually a combination of, of multiple things that make them successful. I usually say that the lack of suitable technology and understanding what technology to use. It's limited governance and a process framework, the business attitude towards technology when it comes to things like patching or updating systems, and who is and is not responsible for ensuring cybersecurity is maintained. As mentioned before, the focus within healthcare is on connecting devices as quickly as they can from productivity and business benefits, instead of securely connecting devices, which can take more time and sometimes be of more of an expensive exercise, which aren't always considered as worthwhile to invest in. So even though there is no silver bullet, you know, we should be able to at least mitigate or minimize some of these attacks from being successful. So if I take a step on how we actually can do that, there's three main things I have seen from my experience that we should be using. The first thing is obviously having a secure platform that can deliver end-to-end security, right? I mean, a lot of vendors can actually deliver security, and they can deliver decent security. But what most vendors aren't able to do is deliver a good end-to-end security. They aren't able to have intelligence sharing between the platforms. And I think that's a key part of being able to mitigate advanced attacks that are done against the healthcare environment. I mean, what I use as a notion, and it's an example, I would say is, if we, the importance of end-to-end security, it's like going to war with the Army, Navy, and Air Force, but with each of them not communicating with one another. How effective would that be, right? Not much, I would think, right? If they don't communicate with each other, they don't share intelligence, they're not going to be effective. But on the other hand, if they actually did share information, they did talk to each other, you know what, they'll be extremely effective. And that's what same principle that you apply when it comes to delivering an end-to-end security platform. And I think, that's what all of these organizations are looking for. And Fortinet's point of view, they seem with the fabric technology, they are able to, deliver these sort of solutions. The other two methods to mitigate and minimize cyber incursions is to obviously have a better governance framework and an educated staff in place. Over the next few slides, what I'll do is I'll touch on the first point a bit. I won't touch on the second or third point, but you know what, if you're happy to go into more detail on those ones, I can have an offline discussion with you guys so that I can help your team if you want, go in more detail and help your customers. So now moving on to the interesting part of the discussion, which is obviously the Fortinet Security Fabric. The value I see from this architecture is the ability to give the organization the ability to consolidate and provide end-to-end protection across the board, without, added complexity and most importantly, the cost. If you have to go with multiple vendors, there's always a lot of costs involved. If you want to buy an access solution, you want to buy a cloud solution, you want to buy an advanced threat protection solution, right? And most of these guys can't do them effectively as well, right? So it's important as a customer, when I was a customer, that you bring in solutions, but they're also CFO friendly, right, in nature. If it's one of the biggest hurdles with security is to try and get them passed through the CFO. So if you can actually come up with a good framework, a good solution, but it's also at the same time cost effective and it's CFO friendly in that sense, the chance of actually pushing them through are highly likely. And I've seen it work well for me. I've been able to push through solutions like SIEM solutions, by looking at how cost effective these solutions are and how they actually integrate with one another. It's a massive frustration at the moment for a lot of customers, that they can't actually get visibility across multiple technologies or share the intelligence or take actions. When there's something and they want to actually take an action against a client, if they see something on a firewall, they want to do something, they can't actually do anything because they don't communicate. And this is what the Fortinet Fabric is all about. It's all about sharing information. It's all about collaboration. And working together and working cohesively to try and protect your environment. And doing it in one ecosystem, it's always favorable compared to using multiple vendors. With the Fortinet, obviously, if you want to use multiple vendors, then as we know, most organizations they don't always have the luck or the opportunity to use single vendor. You can use the partner API and integrate other solutions. And I think this is a massive benefit, and massive value add that Fortinet is obviously giving, to the customer. The holistic approach, obviously, to protect the network from sophisticated attacks and advanced malware. Um, you know, it's a very, very good thing with the security fabric. So, what does the security fabric solutions look like? Well, I feel that actually 6 key technology pillars that I would call that make up the security fabric. We will spend some time on each of them, but from shortly, I want to try and go through a little bit of them. What they actually do. What this the beauty of this solution is that it can actually expand in accordance to the customer's technology and business requirements. You don't have to actually go and rip and replace all the solutions that are in place. You can actually protect the current investments and then slowly move towards a comprehensive solution, which can dynamically adapt to the business needs. As you can see with this slide, the enterprise firewall is obviously the key solution. It's complemented with other solutions from access layer, cloud, applications, and endpoints. Something I like to point out is that regardless of solutions you're going to use or deploy for your customers, the management is simplified by, of course, using a security operations function, which gives visibility and management across all the essential solutions. I would say that with this fabric, the healthcare organizations are well positioned to meet both the existing as well as the future security needs. So, let's have a deeper look as to what these solutions are, and I'll start off with enterprise firewall first. If you look at enterprise firewall platform, which is better known as a FortiGate in a little more depth, we can safely say it's key piece of the entire solution. Apart from obviously being validated by third parties for its performance and capabilities to provide security across the full stack, what I like most about this platform is its ability to be deployed in multiple ways. I mean, starting with a standard firewall, or next-gen firewall, or data center firewall, to even the internal segmentation firewall. It gives the customers a lot of options to choose from, depending on their individual needs. Right? For me, the internal segmentation is quite interesting, as most of the organizations can deploy this with without much cost. You get about 10 VDOM licensing for free, which I think is a massive plus. You can segregate the network using these virtual domains, and that's actually without having to pay for anything. Coming from customer land, where you pay quite a bit of money when you have to segment your network, I think this is a fantastic solution that Fortinet has put together. And I think all customers should be looking at it. All partners should be actually making sure that this is part of the design when they do healthcare solutions. As you can see from the picture, the Firewall platform can be deployed in either the hardware, the virtual, or cloud-based technology as well. If there's a need for Wi-Fi, that can also be enabled with the 540 Wi-Fi model of the FortiGates. As you might, before I actually go on to the key benefits of the secure access platform, the other thing I actually remembered to talk about, wanted to actually talk about is the unique feature with the FortiGate is the ASICs, as some of you might already know, right? I mean, that's obviously extremely unique, and it's one of the things that I have actually spoken with some of the competitor architects, and even they are really, really impressed with the performance level these ASICs can actually do in large environments. So definitely if it works in large environments, they're definitely going to work in hospitals and medical facilities and so on. So that's definitely something you need to really, I think, hit on with customers and make them understand, and it's obviously something that's unique. The final point, obviously, with the FortiGate platform is its ability to integrate with the other solutions. specifically with those solutions that provide advanced threat protections. So now moving on to the secure access platform. The secure access pillar combines a couple of technologies for me. Those are the FortiGate, FortiSwitch, and FortiWireless platforms. From a benefit point of view, I see it not only helps consolidate security networking and access technologies, but also helps to do it in a cost-effective manner. Again, CFO friendly, which I think is important. The other benefit is that it extends the cybersecurity from the network core and edge to that of the access layer. While a lot of attacks now will happen, from the access layer. People don't always think about it. People always, think, your external network is what causes, all the attacks. But, in a lot of environments, we're seeing on a daily basis that attacks happen, from, a USB connection or from a wireless connection or something, or from a switch point or something like that, right? So being able to actually have an integrated security fabric that takes into account all these environments, I think it's a pretty good thing to have. When you look at the wireless technology piece in a little bit more detail, healthcare organizations have the flexibility to select from either the FortiGate integrated option, the cloud option, or the controller-based option. I think that's a good thing to have. I don't see any other vendors that have that sort of capability. If they want to provide the same level of functionality, they would obviously have to use a much larger pool of products. That wouldn't obviously, add, in terms of the cost benefits to the business. It also adds, apart from the cost, it also adds complexity to the environment. And what, as I said before, more cost means, you're not going to get much backing from the CFOs and in some instances from the CIOs as well. So with the Fortinet solution, I think you got a really good cost-effective option to go forward with the customer. So as with everything else, as with other vendors, Fortinet is obviously investing in the cloud platform. And why is that? That's because there's a massive uptake within the healthcare sector on the cloud computing. As it gives them a lot of benefit in terms of deployment and scalability, right? So they're giving them a lot of those benefits. So it's nature for vendors such as Fortinet to look and invest into the cloud security business. And I think that's a good thing for the healthcare sector. I've been quite impressed actually on a personal note that Fortinet added a lot of solutions into both the public and private cloud, so that it can obviously meet the business initiatives that the healthcare and any other vendors any other customers are doing. Even though the FortiGate is what's only shown in the picture, there are many other platforms, as you would know, that are cloud enabled, especially in the private cloud space. Some of them, to name a few, are FortiAnalyzer, FortiMail, FortiManager, FortiSandbox, FortiTeam, and some of and other things like that. One of the benefits I have come across with the Fortinet is their willingness to have the same, consistent policies applied across both the private and public cloud environments. When you have a limited time, the last thing you want to do is make changes on both sides. And sometimes, you're going to forget it. Most of these guys don't have, 5, 10 staff just doing security. They must even have, 1 or 2 staff. They're lucky. So being able to have consistent policies, being able to apply consistent policies, I think that's, that's a massive benefit. The other thing, that's a benefit, obviously, is the ability to, integrate, with leading vendor solutions in the market. With Fortinet's case, they do out-of-the-box integration with both VMware NSX and Cisco ACI. And this is obviously looking, they've done this by taking into account, the customer requirements, and that's a good thing. They're always trying to see, how can it benefit the customers, how can they help the customers, get better performance, get a better investment out of the platform. And they'll continue to do that and do more integrations, obviously, in the future, so that their solutions will be much, much more stronger. Now, if you look at the Fortinet AppSec options, the first benefit that's there is that there's many of them available, and I think that's a good thing. There are a lot of options, more than you can actually remember. But for me, the key ones are obviously, as you can see, the 40 ADC, 40 mail, 40 DDoS, 40 web, and the 40 database platforms. Those are the key ones that I usually recommend when it comes to application security. Having these technologies, available both in hardware and virtual, I think gives a lot of flexibility to healthcare customers. Especially when they're going and investing a lot on the cloud security solutions, it's good to have the virtual platforms. Apart from obviously the flexibility is critical, that these things perform, right? And the best way for me to find out where these things perform is by looking at third-party validations. Something like IDC, for example, right? Because all vendors will always say, what, their products and services are the best in the world, right? But how do we know? How do the customers know they're actually good? As what they keep saying. Well, the best way to find it out is by looking at third-party validations, such as IDC, Gartner, etc., and so on, right? It's an effective tool. I mean, it's not just effective for partners, but it's an effective tool for customers, for especially when some of the decision makers on the customer side are less technical. The other thing I have found valuable with these sort of environments is that when you have a lot of these environments, it's hard to actually get customers to want to buy all these sort of solutions. So the best way is to actually try and see if you can do some POCs. Because once the customer has the opportunity to see the performance and capabilities of these platforms, a lot of things come into place. They would actually have more opportunity to actually create budget if they don't have budget. So that's definitely an angle to take with the customer, especially when you have a lot of solutions, especially in this application security platform. For me, obviously, from experience, the solutions that provide the best applications are the ones that application security obviously is the one that can actually integrate with multiple platforms. Because when you integrate multiple platforms, you're able to detect advanced threats much more easily than when you don't. With the AppSec platforms that Fortinet have, they're able to do this. They do integrate quite well with the FortiGate and FortiSandbox platform, which is one of the key platforms that Fortinet uses for active threat detection against advanced threats. And I think that's a really extremely effective solution. So next solution within the pillar I would like to take everyone across is that of the advanced threat protection that Fortinet has to offer. We find that even though digital transformation in healthcare helps drive organizations forward, advanced persistent threats attacks are continuously holding these guys. They just can't go forward. They're always taking one step forward and two steps back because most of the time they're fighting against attacks that they can't see. They don't know what's happening on the environment. So by having a solution in place which can detect advanced threats, I think Fortinet is able to help the healthcare environment better prevent, better detect, and allow these guys to actually go forward in being innovative in helping them in advancing their patient care. There are 5 key technologies when it comes to advanced threat protection. Those technologies are FortiGate, the FortiMail, the FortiSandbox, FortiWeb, and the FortiClient platforms. Right? I think you need at least a couple of them to actually at least start off with. But for me, you definitely need the firewall, you need the sandboxing, and you need something at least a level of a FortiClient. The key to remember with ATP attack is that it's absolutely vital for technologies to work together with each other. Right? It's definitely something that must happen to make sure that you have the best defense and be able to eliminate any gaps. And with obviously what Fortinet has to offer with the ATP framework, they're able to not only share local intelligence, right, but also communicate with FortiGuard to make sure that you're always up to date with the security services. You always patch, what's going on, because what, these attacks change by the second. There's so many malware that come out each minute that you want to be up to date, and being able to link all these platforms with FortiGuard and keep up to date, I think that's extremely valuable. One thing obviously with the design of these sort of solutions is to make sure that they're strategically placed so that traffic that passes will at least go to one or two of them, so that it gives you the best chance to mitigate or minimize the possible attack. The final piece of the fabric that I like to take you all across is that of the security operations technologies, which cover both the IT and security risk management across the entire network. Having something like this gives organizations a comprehensive view of the entire network, as well as helps identify threats. But you know what? The other benefit it does is that it helps address them quickly. If you don't have, if you didn't have something like this, you can't address these threats very quickly. Most organizations take around 200 days before they're able to detect and find the threat. But having something like a security operations centers with decent technologies behind them, you're able to much detect threats much quickly. Which would otherwise be hard to find. Another benefit, obviously, with having an operation center is that apart from detecting threats, they can also help to manage and monitor compliance. They can also help to manage the application availability, and in some instances even help with saving IT costs or saving IT resources. Right? If you look at the same platform and the cost for the same platform, right, and compare that with if you want a dedicated staff, that's a massive cost. So having a same which can take care of those needs and be able to do those things and automate those sort of risks and everything else and give that to the team, I think that's a great thing to have. As you can see the picture with the slide, there's obviously three subcomponents to the Fortinet security operations. You got the analytics piece, which is covered by the Forti analyzer, the management piece that's covered by the Forti manager, and events and risk management piece covered by the Forti team platform. So how are each of them different? Well, at a high level, the Forti analyzer will be used as the network security logging, analysis, and reporting system. It will aggregate log data from all your Fortinet security appliances. It will also help administrators through its ability to help quickly analyze, interpret, visualize network threats and efficiencies and bandwidth usage. As for the Forti manager, its main job is to deliver the versatility required to effectively manage a Fortinet-based security infrastructure. And it does this by having a centralized policy management, analytics, and reporting platform. Having such a platform obviously reduces management costs. It simplifies your configuration. It helps accelerate deployment. In small environments, this might not be of much use, but in large data centers and large environments, this is this is a great benefit, I would say, to have something like a Forti manager in place. Forti team, on the other hand, obviously provides organizations with the ability to quickly find and fix security threats and manage compliance standards needed by each individual organization. It has pre-built reporting for HIPAA, PCI, SOX, and so on. Also, other benefits, something like a same platform is that it's not only catered towards the Fortinet devices. You can also add other devices, like Internet of Things and so on into this. And you can feed data into this platform. And I think that's another benefit having a same platform. So before we touch on some case studies, I thought it'd be good to share this slide so everyone on the call can understand where Fortinet is positioned when it comes to the healthcare sector, as well as other industries, if you already aren't aware. I think it's fantastic that they have 7 of the top 10 USA health systems and 7 of the top 10 largest pharmaceuticals in the world. Now, why is that good? I think that's good because it will only help them develop better solutions moving forward in this industry. Right? Having the visibility into this environment and understanding the threats and the landscape, it will only make it better and be able to in the next couple of years develop their solutions as it goes on. So I think that's a good thing to have in their portfolio. So if you have customers and just like what, we haven't heard of Fortinet, do they actually have customers? Do they actually have decent customers? You can always go back and tell them yes, they do have large environments where they where they've been placed. So they can you can give them the comfort that you're not just buying a new solution that's never been used in the industry. As a customer, it was always keen. It was always vital for us to make sure the solution we put in place is actually being used in other places. Similar places, obviously. So, you can obviously talk about that with your customers. Before I move on to the case studies, I just want to let everyone know that the information on the specific ones that I will show you are also available on the Fortinet website. If you want to get them in more detail, there's usually PDFs on each of them. If you still need more information, let me know, and I'll see what I can do to get more additional data for you guys. So this one's actually a local project that was done by Fortinet. What I liked about it was that it not only gave a lot of security for the environment, but it also ensured a lot of cost savings. So if you look at the business impact section, there was a 40% cost savings per annum over the legacy systems. That's a massive benefit. What that the hospitals or the medical centers can actually then use. Towards ensuring that they give better services for patients, improving their patient care. That's what they're in business for. They're not in the business to actually to be secure. They're in the business to improve patient care. And if they can save that sort of money, they can actually use it to delivering that sort of service. And that's the way you want to see things happen. That's one of the main things that stood out for me. Apart from that was obviously uptime. These systems, medical centers are always critical. They need to be uptime. Have almost 100% uptime. If they're not uptime, doctors can't get the information. So to improve that was a major thing that Fortinet was able to do compared to the legacy system. What I take out of this particular case study is that it was the ability of Fortinet to deliver across a wide spectrum of locations. I mean, 250 is a decent size deployment that Fortinet is able to do. Right? I mean, there's not a lot of hospitals in Australia that have that many locations. So I think the thing that you get out of this is that Fortinet solutions can be deployed across a large area, large customer base we require. So that's something definitely worthwhile taking out of this. Apart from that, obviously, what was able to consolidate. It was able to consolidate the network and security platforms, and thereby, simplify, what it delivered, and make sure that what is so easy to use for the technical teams. So this was another decent site installed in Fortinet. I mean, scaling for around 5,000 people. And what they did was they unified access and security across 100 facilities, which I think is a good thing. So again, a decent size deployment, a decent size security deployment, which it's good that Fortinet is able to do that. It gives customers the benefit that Fortinet is definitely a vendor to look at in more detail, and they have good solutions and something that you can take going forward. So what else are the Fortinet's healthcare footprint? Well, we got a lot more footprint than those few customers I mentioned. So as you can see, there's a lot more, right? The two organizations that stood out to me was obviously GSK and Johnson & Johnson, right? Both were leading brands and known by many people, right? So I think this is a powerful story that Fortinet has in the healthcare sector. So yeah, if you want to get more information about these, please let me know, or you can go online and on the Fortinet website you will get more data. So what does the Fortinet healthcare solution deliver? hopefully from today's presentation, we can all agree that it delivers centralized, robust, effective security solution that continuously outperforms expectations, right? And you know what? It's also one that's actually that can be done. It can actually it's independently tested. It's certified, and it's importantly affordable to the end customer. When compared with anything else out there in the market. I mean, for me, that's the key part. It's the fact that it's not just them saying what they're the best and the greatest. Also the fact that you got independent third parties that certify their solutions and talk about their solutions. Say, what, these guys are actually good to use. And the solutions come at an affordable cost. We put all these things together, and if you take another vendor and if you actually put their solutions together and they can't do most of it, they got to buy get another third party. That's a massive cost, which what the Fortinet can cover, and that's a key part of the whole picture of what Fortinet can deliver to the healthcare. Before we finish, I just want to touch on some things that services we can actually offer when it comes to Fortinet at Wavelink. If you have a requirement to do things like cyber threat assessment, or you need an evaluation kit, or you want assistance setting up a POC, or even doing a complex wireless site survey, don't hesitate to get in touch with us. We got a strong background in healthcare. We've been doing healthcare, aged care for 15, 20 years almost. We can design, implement services obviously for Fortinet, but the other thing we can obviously do for the partners is that we can also, one thing I find that we can differentiate is that we can also offer, your team the ability to provide more cybersecurity advisory services, in addition to Fortinet implementation services. If this is a space you want to get into as a partner, and you find that way you can add value to your customer, please give us a call. We'll be more than happy to help you, get to that stage. We'll continue to offer these types of webinars in the future, so please let us know if you're interested. In addition to the webinars, we'll also start running some workshops in the near future. So let us know if you're interested to attend them. Just note, the workshops are also open to partners as well as end customers. So as a final note, before we go to questions, I just wanted to introduce Hugo, who just joined us on Monday. Hugo has around 3 years experience on the Fortinet side, coming from Ingram Micro in New Zealand, where he was a National Business Development Manager for the Fortinet business within Ingram. He has a wealth of knowledge when it comes to Fortinet, and he's more than happy to help you day or night. Anytime give him a call, whether it's 3 o'clock in the morning, he's more than happy to take your call and help you answer any questions that you might have. Our details are here, so if you want to note them down, you can do that, or when we send the presentations out later during the day, you can have them. Okay, so that's the main part of the presentation. I know it took around 50 minutes or so thanks a lot for your patience. Hope that was worthwhile. I'm happy to take some questions if you have any of them, so please use your question box and let me know. And yep, so yes, we have one question. Is the presentation slides going to be available? Yes, absolutely. We'll have them available later in the day, as well as we'll be putting up the presentation on our YouTube channel. Okay, I guess that's all the questions we have for today. Let me just check quickly. Yep, that's all we have for today. Appreciate you taking your time in the morning to listen to this. Please don't hesitate to contact Hugo or myself. We're more than happy to help you. Want to thank you guys for taking your time today and your patience. So I trust you got something out of it, and we'll send the presentation slides later in the day. So yeah, thanks for your time, and have a good day.